Imagine having an uninvited guest who loves to keep your heart racing as if you're in a never-ending marathon, even though you're just watching television. Or an uninvited guest hosting a pool party, making you feel like breathing through a snorkel. That is what happens in left-sided heart failure. Blood backs up into the lungs, causing you these symptoms. Hello everyone, I am Zaraya Vasquez de la Cruz from BSN Level 3 Section B, and today, along with Miss Maria Tricia Olano from Section D, we will discuss what left-sided heart failure is. The left ventricle has the most pumping power of all four chambers because in order to supply blood all over the body, the left ventricle will squeeze out that blood and deliver it through the aortic valve, the aorta, and all throughout the body. However, in left-sided heart failure, the left ventricle is not squeezing out that blood. So all the blood that's coming from the left atrium pouring down the left ventricle is backing up into the lungs because the left ventricle is not emptying. It's not doing its job. So all the blood that's pouring down the left ventricle is going back up into the lungs and thus preventing organs from receiving enough oxygen. So what's gonna happen? What's gonna happen next? Okay, so if you're going to listen for lung sounds, you're gonna hear some rails or cackles. Left-sided heart failure is further classified into two types. We have systolic heart failure and diastolic heart failure. So you may ask, what is the difference between the two? Okay, so when we say systolic heart failure, that is when the left ventricle cannot contract blood properly. So as a result, there is an inadequate oxygen-rich blood that is being pumped all over the body. And when we say diastolic heart failure naman, that is when the left ventricle is too stiff to allow for blood filling. And as a result, the oxygenated blood that is being pumped all over the body is reduced or is diminished. So over time, this blood builds up in the left atrium and in the lungs, leading to fluid congestion and signs of heart failure. Okay, so in this slide, we have the causes. So number one, we have coronary artery disease. So when we say coronary artery disease, the coronary artery is blocked or narrowed. So basically, if that happens, the supply of blood oxygen all throughout the body is reduced. Now, if that narrowing or if that blockage is prolonged or becomes severe, it causes heart attack or myocardial infarction where part of the heart muscle dies. Now, that damaged heart muscle becomes weaker and less able to contract, reducing the heart's ability to pump effectively. So, the left ventricle struggles to pump, causing the heart output to drop and leading to poor circulation all throughout the body. As a response, the body will activate various mechanisms like increasing the heart rate, but it will only worsen the condition. The left ventricle begins to enlarge and weaken over time, and there is also an increased pressure within the heart. This pressure backs up into the lungs, causing fluid buildup or what we call the pulmonary edema and difficulty breathing. As the heart's pumping capacity or ability diminishes, this results to left-sided heart failure. That is where the heart can no longer meet the body's demands. And then number two, we have hypertension. So hypertension makes the heart work even harder. So it makes the heart work beyond normal because of the increased pressure in the arteries. So to compensate or to cope with the increased demand, the left ventricle thickens, or what we call the hypertrophy. So this initially helps maintain cardiac output, but the thickened muscle becomes stiff, making it harder for the ventricle to relax and fill with blood. As the left ventricle struggles to fill, pressure builds up in the left atrium and backs up into the lungs, causing fluid to accumulate, which is what we call the pulmonary congestion. So this leads to symptoms of shortness of breath and fluid retention. So over time, the heart's ability to pump blood is reduced, or it effectively declines, resulting to left-sided heart failure. Okay, so number 3, we have valve defects. So in aortic stenosis, the narrowed valve forces the heart to pump harder to push blood through. And this extra strain can cause the left ventricle to stiffen and eventually weaken, leading to heart failure. Now in mitral stenosis, valve doesn't close properly, allowing blood to leak back into the heart, causing it to enlarge and weaken over time. This condition can result in decreased efficiency, fluid buildup in the lungs, and ultimately left-sided heart failure. And then number 4, we have myocarditis. Myocarditis is an inflammation of the heart muscle. So this inflammation can weaken the heart, affecting its ability to pump blood effectively. And as a result, the left ventricle, which is the main pumping chamber of the heart, may not be able to pump blood efficiently throughout the body. And then lastly, we have metabolic disorders affecting the heart. Okay, so these are the signs and symptoms or clinical manifestations to look out for in patients with left-sided heart failure. So number 1, we have difficulty breathing, of course. Number 2, we have rills or crackles, which I already explained kanina, and it is an abnormal sound indicating pulmonary edema. Number 3, we have orthopnea. So this happens whenever a patient lies supine in bed and they can't breathe. So nursing responsibility teach the patient to do high Fowler's position or to dangle their feet at the bedside to decrease venous blood return and decrease preload to the heart. Number 4, weakness, of course, because our patient has a weak heart, they are unable to maintain cardiac output, and so they really can't tolerate a lot of activity. Number 5, we have nocturnal paroxysmal dyspnea. So this happens when a person have sudden attacks while they are sleeping, and they wake up suddenly feeling like they can't breathe. So nursing responsibility, you can tell the patient to stack a pillow while sleeping. And then you have increased heart rate, and then of course nagging cough, which is one of the early signs and symptoms that the heart is getting weak in a patient with heart failure. So it is very important for nurses to educate their patient to watch out for this dry nagging cough and to report it so that they can get treated and monitor that the cough isn't becoming productive, where they're getting frothy, foamy, blood-tinged cough, because that is a very bad sign and that requires immediate medical attention. And lastly, we have gaining weight. Kasi weight is an early indicator that fluid volume overload is maybe presenting. Okay, so we'll come now to diagnostic test. Number 1, we have BNP biomarker blood test. So this is done to diagnose heart failure, to determine its severity, to monitor the effectiveness of heart failure treatments, to rule out heart failure, and to predict the likelihood of heart failure worsening. Number 2, we have cardiac computed tomography. So this can help identify blockages or narrowing of the arteries and detect problems with the heart's pumping function. We also have laboratory tests including BNP, troponin T, and electrolyte panel. We have electrocardiogram, which shows how the heart is beating. Echocardiogram, which can diagnose a range of conditions including cardiomyopathy and valve diseases. We also have right heart catheterization, which can help diagnose heart conditions and determine the right treatment. It is often used to diagnose pulmonary hypertension. And lastly, we have handheld oceanography. So this can also help heart conditions and determine the right treatment. It is often used to diagnose hypertension, same as right heart catheterization.
Good morning everyone, my name is Maritza Olano and I'll be discussing the medical management for individuals with left-sided heart failures. We have pharmacological treatments, non-pharmacological approaches, and device therapy. Let's first go with the pharmacological treatments. We have ACE inhibitors or ARBs together with beta blockers, or we can use medications such as hydralazines and nitrates or vasodilation. In combination, both are good for relaxation of blood vessels and decreasing the workload in the heart. Now for the mineralocorticoids receptor antagonist, it is good for managing fluid retention. For the ivabradine, we can use it to reduce heart rate. It is beneficial for patients with heart failure. Now for the digoxin, it acts as an inotrope, which means it increases the force of the heart's contraction, improving the cardiac output of the patient. Now let's proceed to the non-pharmacological approaches that we can do. First is we have to modify our lifestyle, which includes healthy diet, regular exercise, cessation of smoking and drinking. You can also do weight management. And second is we have to control our blood pressure. Now we can control our blood pressure by modifying our lifestyle and taking medications for the hypertension. And lastly, we have the revascularization for ischemic cardiomyopathy. And now let's proceed to the last medical management, which is the device therapy. In advanced cases, we use devices such as implantable cardioverter defibrillator, or the other one that is similar to it, which is the cardiac resynchronization therapy. And lastly, mechanical circulatory assist device. Now let's know more about it. And now let's talk about the implantable cardioverter defibrillator. Now this is a small device, small battery-powered device that is placed in the chest of the patient. Its purpose is to detect and stop irregular heartbeats, or what we so-called arrhythmias. And it sends electric shocks whenever it needs to restore regular heart rhythm. Now next we have the cardiac resynchronization therapy. Now for the cardiac resynchronization therapy, Now, this is a treatment to help restore the normal timing pattern of the heartbeat. The only difference between the ICD and the CRT is that the ICD is more focused on correcting the abnormal heartbeat, while the CRT is that it focuses on improving the mechanical pumping ability of the heart. Now let's talk about the mechanical circulatory assist device. Now this is a device that helps our lungs or heart function because our heart or lungs is not functioning well, so we need the help of this device. This device either steps in temporarily or permanently to supplement or replace the action of the failing heart or lungs. Now on this slide, let's talk about the surgical management for left-sided heart failure. We have 4 of them. We have the ventricular restoration, mitral valve repair, and the coronary artery bypass. And lastly, we have the implantable devices. Let's have first the ventricular restoration. Now in the ventricular restoration, it is a procedure that is done to repair the heart ventricle, typically the left ventricle, by removing the scar tissues and reshaping and resizing it back to its normal shape and size. In the mitral valve repair naman, we have here, this is a procedure that actually fixes the heart valve for proper function and proper function. And for the coronary artery bypass surgery, this is a procedure that is done to improve the blood flow to the heart by creating a new route for the blood to flow because there are a lot of blockages in the arteries. Now for the implantable devices, these are devices that are inserted in the patient's body that helps the body parts of the patient such as heart or lungs function properly. These devices can either be for a short period of time or for a long time use. Now let's have the prevention for left-sided heart failure. We can prevent the left-sided heart failure by managing the risk factors, changes in our lifestyle, early detection for it, and even early treatment for it. Compliance with treatment plans and patient education play a significant role in preventing complications or further complications. Now let's go to the pathophysiology of left-sided heart failure. Now we can see on the image that is flashed on the screen, we have blue boxes that contains the major factors that causes left-sided heart failure, and the purple boxes represents the mechanism, and while for the pink it represents for the end result or the complication. Let's begin with dilated cardiomyopathies, which we all know that is a heart condition that causes the heart's main pumping chamber to enlarge and weaken, making it difficult for our heart to pump blood. That will result to myocyte loss and interstitial fibrosis. Once we have this myocyte loss and interstitial fibrosis, this will result for our left ventricle to decrease its contractility. Since the left ventricle decreases its contractility, it will result to systolic dysfunction, meaning the left ventricle can't squeeze or empty well. Therefore, there will be a decrease in ejection fraction. Now, this ejection fraction typically refers to how much oxygen-rich blood is pumped out of the left ventricle to most of the body's organs with each contraction. Left ventricle stroke volume decreases, reducing cardiac output, and not enough blood is pumped into the systemic vessels to meet the body's metabolic demands. Blood backs up into the lungs, causing pulmonary congestion. Symptoms and signs of decrease in cardiac output and congestion results in, and now we have the left-sided heart failure. Now let's have the mitral and aortic regurgitation. The mitral regurgitation is when the mitral valve doesn't close all the way. Blood flows backward from the lower chamber of the heart left ventricle to the upper chamber or the left atrium, which can cause the upper heart to pump harder to compensate, which can lead to congestive heart failure. While the aortic regurgitation, it is when the aortic valve doesn't close all the way and the blood leaks backward into the left ventricle each time the heart relaxes. This can cause a combined volume and pressure load on the left ventricle. So when we have this, we will have chronic volume overload that will result to left ventricle dilation and hypertrophy. And that will result to decrease in left ventricle contractility, resulting to the systolic dysfunction that will further progress into a left-sided heart failure. Now let's proceed to the myocardial infarction, which is also known as heart attack, which occurs when the blood flow decreases or stops in one of the coronary arteries of the heart. This results to necrotic, which is the death of tissues, and non-functional myocytes. Now these non-functional myocytes plays a critical role in the cardiac regeneration. Now this will result in decrease in left ventricle contractility, resulting to the systolic dysfunction again, where the left ventricle can't squeeze or empty well, and it will have a decrease in ejection fraction as well, resulting to the left-sided heart failure. Now let's have severe hypertension and advanced aortic stenosis. Now this advanced aortic stenosis occurs when the aortic valves become narrowed and stiff, preventing it from opening fully. Now this too will result in increased resistance to left ventricle ejection and will have a increase in afterload. Once we have this will result to chronic left ventricle pressure overload, resulting to the left ventricle dilation, hypertrophy, and fibrosis, to be followed with the decrease in left ventricle contractility that will result to systolic dysfunction and will eventually result in left-sided heart failure. Now let's have the cardiac tamponade, myocardial ischemia, and hypertrophic cardiomyopathy. Now let's first go with the cardiac tamponade, in which occurs when fluid or blood builds up in the sac around the heart, preventing the heart from pumping enough blood to the body. While the myocardial ischemia occurs when the heart muscle doesn't receive enough oxygen due to the reduced blood flow. Now let's go with the myocardial fibrosis, which is a condition where the muscle tissues of the heart becomes thickened, resulting in left ventricle relaxation decrease and blood entry decrease in diastole. That will further progress into a decrease in left ventricular and diastolic volume. And when this occurs, diastolic dysfunction occurs where the left ventricle can't relax or fill well, even though ejection fraction is preserved, further resulting to left-sided heart failure. Now let's proceed to the myocardial fibrosis and restrictive cardiomyopathy. Myocardial fibrosis is a condition that involves the buildup of scar tissue in the myocardium, which is the heart muscle. Most common causes of this fibrosis is the heart attacks. Now let's proceed to the restrictive cardiomyopathy. This is a form of cardiomyopathy in which the walls of the heart are rigid. Thus, the heart is restricted from stretching and filling with blood properly. Now, the myocardial fibrosis and the restrictive cardiomyopathy both results in the increased left ventricular wall stiffness, resulting to decrease in left ventricular and diastolic volume, or EDV. Now, this EDV is the amount of blood in the heart's ventricles after they are fully filled and before they contract. This is also called as the preload. Since there is a decrease in the preload, this will result in diastolic dysfunction, resulting in left-sided heart failure. Now, with this brief explanation of the pathophysiology of the left-sided heart failure, I hope you learned something.